Hey everyone, my name is Daenzer, and for this week's discussion, I chose to research a fast moving, life threatening disease called sepsis, which is systemic inflammatory response to infection. Imagine your body fighting an infection, but instead of healing, the body turns against itself. What really caught my attention is how quickly sepsis can affect multiple organ systems, sometimes before doctors can even find the source of an infection. This further highlights how interconnected our body systems are and how crucial early recognition is. The Cleveland Clinic in Ohio indicates that 1.7 million people in the United States are diagnosed with sepsis each year. Additionally, sepsis, or septic shock, can cause death in as little as 12 hours. In this video, I will walk you through how sepsis impacts the body, various treatments and disease management techniques, and most importantly, discuss how science equips us to be a part of God's healing and redemptive work. Sepsis is a life-threatening condition caused by the body's response to infection, triggering widespread inflammation. The immune system begins to attack the body's own tissues and organs. As stated by the Mayo Clinic, documented on February 10th, 2023, potential risk factors may include, and please note that these are not a complete list of identified risk factors, these are just the ones that I found to be more significant, are people over 65, infancy or infants, people with lower immune response, such as those being treated for cancer, or people with human immunodeficiency virus, otherwise known as HIV, people with chronic diseases such as diabetes, kidney disease, or chronic obstructive pulmonary disease, or COPD. Individuals that have been admitted to intensive care units or have had longer stays at hospitals. It also includes individuals who have had medical devices in their body, such as catheters in their veins called intravenous or breathing tubes. Another key indicator is someone who has been treated with antibiotics within the last 90 days. Common symptoms of sepsis are, again, not an extensive list, but the key indicators that I believe and what I've read to be most important are low blood pressure, which leads to septic shock, high fever over 100.8, or abnormally low body temperature, which is 96.8 degrees. Rapid heart rate and breathing, confusion or disorientation, decreased urine output, or cold, clammy, and discolored skin. One of the main organ systems that are affected by sepsis is the respiratory system. A few key indicators are cytokine storm, which causes inflammation and damage to the thin barrier between the alveoli and capillaries, leading to fluid leakage into the lungs, causing damage to lung tissue, called inflammatory response. And I'd like to note here that without timely intervention, lung injury can progress to full respiratory failure, thus often requiring mechanical ventilation assistance. Another effect of the respiratory system is acute respiratory distress syndrome, or abbreviated as RDS, which is a serious, often life-threatening lung complication that can happen during sepsis. In simpler terms, the lungs filled with fluid, not because of the heart failure or the heart is failing, but because the infection has triggered widespread inflammation. This inflammation makes the tiny blood vessels in the lungs leak, allowing fluid to build up in the air sacs. When this happens, oxygen can't move properly from the lungs into the bloodstream, which means the body's organs and tissues aren't getting the oxygen they need to function. This is what doctors mean when they say impaired gas exchange. Another system that is affected by sepsis is the cardiovascular system. Blood vessels dilate and leak, reducing blood pressure and oxygen supply within the body. It can also lead to septic shock and organ failure. The nervous system is affected by reduced blood flow, which can cause confusion, agitation, and sometimes induce a coma. Also, long-term effects in survivor may be cognitive impairment. And the final system that I will be discussing is the renal system, which is your kidneys, or most importantly, your kidneys. The blood flow to the kidneys is compromised, thus causing acute kidney injury or failure. The toxins accumulate, and ultimately it worsens overall body stress, which could cause renal failure. As I stated before, early diagnosis and intervention are critical for survival. Other additional standard medical interventions include treatment and disease management are IV fluids to help stabilize blood pressure, a broad spectrum of antibiotics to help combat the underlying infection, vasopressors if fluids are not enough to help raise the blood pressure, dialysis if the kidney function begins to fail, and again, in severe cases, surgery may be required in order to control the source of the issue, i.e. surgical drainage and or removing the infected tissues, or providing oxygen support via an oxygen mask, or the use of mechanical ventilation machines. I believe that in reference to God's redemptive work, that doctors, nurses, and researchers are instruments of healing. Their work in diagnosing and treating sepsis is part of God's redemptive plan. Thus, by restoring health, offering second chances, and most importantly, it shows God's love in action. The scripture verse that came to mind during my research is 1 Peter chapter 4, verse 10, which reads, "As each has received a gift, use it to serve one another as good stewards of God's varied grace." I interpret this as God's way of encouraging us to care for the sick and use our gifts to serve others, thus reflecting God's heart through science and service. In closing, I'd like to mention that this topic has reminded me that behind every medical condition, such as sepsis, is a person, a family, or someone in a family, and someone within a community. Now, as we look ahead to our future careers and callings, I think it's important to carry both the knowledge that we've learned and compassion with us. And in the bigger sense of things, it's a reminder of how God calls us to serve others, which in this sense, through science, empathy, and the unique gifts He's given each of us. By knowing how this disease works and how to respond quickly can literally be the difference between life and death. If you'd like to research more about this critical disease, I will post my references below in the comments after this video. Thanks for watching.